Okay, thank you everybody for attending tonight. My name is Craig Henry. I'm the superintendent of the Southern Regional School District, and we're really proud to be rolling out our second year of a collaboration between the Southern Regional School District and the Southern Ocean Medical Center, wherein with all of the new and evolving technology and knowledge that we have about the importance of head trauma and understanding and recognizing head injury and then correctly treating head injury, we're really happy to be in this collaboration wherein we can offer at a very reasonable cost impact testing, which is a pre-condition testing that will give us baseline information that if the athlete does sustain any kind of head trauma throughout the course of competition, we have baseline data that can be compared and contrasted with post-trauma data to determine the depth or severity of the actual injury. And so we're really proud to be in this collaboration, and we're really happy to be presenting this information to you. I also want to welcome not only the parents who were attending in person, but all those who are viewing on Channel 21 through the Southern News Network. And on that note, I'd also like to thank our Southern News Network crew for being here tonight and helping us with this production. And so it's all about this impact testing and encouraging you to have your daughter or son participate in impact testing. We're different than a lot of other districts. We're not forcing you to do it. It's your choice whether you participate in this, although we highly encourage it. And we've worked out, as I said, a collaboration with the Southern Ocean Medical Center, wherein it's a very cost-effective $5 baseline test, and that you own the results of, that you have access to, so you get to pick who your treatment provider is going to be in the event that a head trauma does occur. So with no further ado, I'm going to turn it over to Dr. Paparegina, who I'm very grateful is taking time out of her busy schedule to be here. She's going to talk to you about some of the baseline information, what you need to know as a parent of an athlete, what signs to look for, what to expect in the event of any kind of head injury, and then what that treatment protocol could look like, and then followed up with what re-immersion into not only athletics, but more importantly into the academic environment would look like on a scaled and re-immersion program. So, Dr. Paparegina, the floor is yours.
Thank you. And thank you again, and thank you everybody for attending this evening. I really cannot think of anything else in neurology or medicine who has gotten as much attention in sports as far as over the last several years as concussions. I think if you look at even Little League, if you look at Pro League, if you look at all these athletes, if you listen to the news, the NFL, the NBA, all of these, one of the things that you see over and over again is the impact of concussion on athletes, not only in the short term, but also in the long term. The NFL, of course, is the one that has been in the news the most in reference to actually being sued by former athletes in reference to concussion, the diagnosis of concussions in the past, and the treatment of concussions in the future. So this is something that has been in the news, and of course is one of the most interesting topics in neurology and in sports nowadays. And it's one of the things that we try to instill the importance of concussion and the treatment of concussion and the importance of treating concussion in athletes as small as little leaguers, as older, of course, as pro athletes. Of course, what is a concussion, and what are some of the symptoms that you as parents have to recognize as concussions? And we all know, as we all had children that play sports, gone are the days where the child gets hit on the head and back they go into the field and continue to play. We have realized over the years that that is not only not good for the performance of the child at that point, but it's also not good in the long run. And we know that striking your head over and over or sustaining an injury to the brain, even if you don't strike your head, even if you get whiplash type injuries, over time and in the short run and over time, it can lead to significant deficits. And what are some of these deficits? These deficits can be anything from symptoms such as headaches, dizziness, nausea, incoordination, to things like difficulty with concentration, difficulty with completing tasks, difficulty with sleeping, even depression in the short run. So and why does that happen? That happens because when the brain sustains an injury, even as small as a whiplash injuries, there are certain chemical changes and vascular changes that occur to the brains that leads to chemical and vascular phenomenon that will interfere with activities that the child has to do both in the short run and the long run. Now, a lot of times when you have a child that plays sports, they strike their head and, you know, they might not even tell you. They may be at the bottom of the pile or on top of the pile, and they want to go back to playing, and they want to go back to finish that activity that they were doing. So a lot of times the child may not tell you, and that is why coaches nowadays, and of course parents nowadays, as soon as they see something, should be aware that if something has happened, particularly if the child appears dazed as he's walking off the field or isn't sure exactly what's going on, that this child should be taken a look at by a healthcare professional. A lot of times parents, you know, if the child loses consciousness or gets hit, well, we all know that that child needs to be brought to the emergency room, but it's the lesser injuries that sometimes go unrecognized. These children sometimes end up in the emergency room, they get CAT scans, the CAT scans is normal, they go home and they start complaining of headaches or nausea or some of those other things. And people will say, well, the CAT scan is normal, they must nothing is wrong, and that's not true. A CAT scan only tells you really serious injuries. It does not tell you whether or not a concussion has taken place. In fact, nowadays we don't even recommend that every single child that has a concussion gets a CAT scan, because otherwise it will have children with a lot of unnecessary radiation. If you get a concussion this year, and later on this year, you'll be getting 2 or 3 or 4 CAT scans, and that's really not needed. So one of the things that we try to emphasize with the impact testing, and as was said previously, not every school system in the state of New Jersey has made this mandatory, although some of them have. You know, what we try to do is we try to determine what is the functioning of a child before the season starts or before playing starts. And what happens if a concussion takes place? And can we test this child to see is there a time that he returns to baseline that it is better for him to go back to sports? I mean, the headaches may be gone, the nausea, the dizziness, the ringing in the ear may be gone, but they may still be doing poorly on testing. And that's important, as I said, not just for short-term, but for long-term performance of the child. The impact testing is a computerized testing, and all your children will be taking it. It's about 20 to 30-minute testing. And basically what it does, it determines almost cognitive function, concentration, attention, memory, and it gives them a score. And based on that score, we can say this is normal for this child within the age group, you know, pre-injury. And then we see what happens post-injury. Now, we don't repeat it on a daily basis if the child does have a concussion. You know, it doesn't really serve any purpose to retest within the first week. So we usually wait about a week or so to retest. You know, a child a lot of times comes to my office complaining of any sports, pick a sport, because I've seen anything from soccer to cheerleading to hockey to anything. I mean, you know, even things, surfing, swimming, almost everything. I've seen kids on almost every single sport. And they will have struck their head, they didn't really lose consciousness, they might not even gotten a cut or an abrasion or anything. They were complaining of a headache, they went to the emergency room, everything was okay. When they were observed in the emergency room, they were sent home. And then the next day they say the headaches maybe is a little bit more, or they're really sleeping a little bit more than they should, or they just don't seem with it, or they seem very slow in their responses and some of their activities, having difficulty if they're taking a test at school, if they have to take a test at school, having difficulty with that test. So hopefully this child has had an impact testing before the season and has scored a normal, what's considered a normal, or a certain range that is considered acceptable. And then it comes back comes to the office, and what we do is, besides evaluating and asking about some of these symptoms that occur, you know, we do repeat a testing, and what we see is that almost every, whether it be visual memory, recognition of things, seems to have declined. So this is a child whose brain is really responding to the injuries in what we call a hyperexcitable state, a very sensitive state. So what we try to do is we try to sort of limit the activities that the child is doing at this point. That is why we usually take this child out of the sports, whatever sport it is. And what we say is, you know, it's not just taking you out of the sports, but it's also trying to rest as much as possible, minimizing any stimulation that may be occurring too much, for example, television, texting, video games, any of that. eat properly, sleep properly. Anybody who has teenagers or children knows that sleeping, eating, and doing things properly is probably not in their genetic makeup at that point. But what we try to do is sort of take them away from anything that may stress the brain. And that at times does include also taking them away from classes, or if they have to go to, if they feel that they, if the injury is not as severe and they feel they can go to class, maybe postpone some of their testing, give them extra time for projects or extra time for assignments or some of the things that they need to take. I know kids who have had to take some school tests or state tests, and that Saturday after an injury, and from examining this child and seeing how much their impact testing has changed, that really they're not going to do well on some of these testing. So maybe we can postpone that, maybe we can postpone some of their finals or some of their midterms or some of their other testing that goes on. And then what we try to do is maybe retest them a week later, see how they do after they follow directions, hopefully. And then what happens is that if their symptoms goes away and their test goes back to baseline, then we clear them to go back to sports. And even going back to sports, it's not like we send them back into, running, whatever it is they need to run a mile, 2 miles, or whatever. The state of New Jersey, just like some of the other states, has a gradual return to activities protocol where you slowly increase the activity that the child does. And why is any of this important? Well, because as I said, it's not just, short-term problems that children can have, but it's also long-term problems. We know that sequential injuries, one after the other, is very harmful to the brain. We know that the brain does not do well. We do know that long-term damage can occur if the brain is continuously injured and does not get a chance to recover, and they will impact the child, as I said, years to come. We certainly know that repetitive injury to the brain, for example, in boxers, can lead to certain neurodegenerative disorders. We know Muhammad Ali, for example, and his Parkinson's disease. We know some of the other football players and ALS, or Lou Gehrig's disease. So we do know that the brain does not do well with repetitive injury. So what we try to do is get the brain to a level where it was before the injuries, before they can go back and resume some activities. Now, as we said before, the impact testing, it's not the only thing that we use. The impact testing is a tool that we have. It's something that we can use to access, to basically see what is it that the child is capable of doing. And that is why it's so important for us to get a baseline. Because if we have the baseline, if we have deficits subsequently, then we can compare. I've also had the case where, baselines have been taken, the child gets hit in the head, and he does much better on the testing. So, so all these things need to be taken in consideration. Sometimes if you do the testing in large groups, for example, kids get, they get distracted, they may push the wrong button, and then you look at the impact testing and you said, are you sure you didn't hit your head before you came to take this test? But sometimes if they don't have a full effort, their scores on the impact testing will not be as good as it should be. I've had that. I've also had kids who have had a whole list of symptoms, and then they come back a week later and they say, boy, I'm really doing great, no more headaches, no more dizziness, it's fine. And the mother or the father is going there, that's not true. I tell him something, he doesn't really follow through, and a lot of times what happens is the child wants to go back to sports, and so they'll say, it doesn't matter if I have headaches or not, I'll just go back to playing. And then we do the impact testing, and that tells us, well, this is really not as good as you could be. A lot of times, within a week, the child does much better, and all the symptoms are gone. Any symptoms from a concussion, from striking your head, can last hours to days to weeks. And also, there's no significant relationship between how severe the injury is and how severe the symptoms are. You can have a mild injury with significant symptoms, or you can have a severe injury with no symptoms. So every child, every case, every injury is separate. And so one of the things is that to take that entire picture, both the clinical picture, the testing pictures together, so that your child can get the treatments that he needs. As I said before, we certainly don't recommend that every child who has a concussion get a CAT scan. However, if there are symptoms that persist, if there are strange symptoms on exams, if there are different findings on exam that make us, raise a red flag, probably we would get an imaging, whether it be an MRI or a CAT scan. Most of the time we would get an MRI because of radiation. Most of the times we don't. I think the majority of children that I see, we don't. Most of the children are pretty compliant to the resting and eating properly and limiting the amount of stimulation that goes on. So, I mean, children, will do a lot to return to their sports that they want to return to. Years ago, we used to cocoon the child. We used to put the child in a total dark room, tell them to sleep as much as possible, no sounds, no light, none of that, to try to, quote, rest the brain as much as possible. We don't do that as much today because we find that probably drives kids crazy and probably drives the parents crazy. So, limitation doesn't necessarily mean abstinence from everything. But depending on the severity of the injuries, we determine where to go from there as far as returning to sports, not returning to sports, and even additional testing. If we find that there is significant injury and there's significant impact, particularly if this is not the first injury that the child has had. A lot of times, we do have access to additional testing, neuropsychological testing. We also have access to therapy if we need to, whether it be cognitive therapy, behavioral therapy. As I said before, there's a lot of children who, after a head injury or a sequential head injury, can even have behavioral issues, depression, and sometimes some of those need to be addressed besides the headaches, the nausea, the dizziness. Most of the times we don't really need to, we can, if it's severe enough, try different medication or symptomatic relief, Motrin, Tylenol, etc. But a lot of time we find that with simple resting, some of those symptoms will go away. The majority of symptoms will go away. One of the things that we're trying to hopefully, promote is that the child every year get an impact testing. Let's say, your child is year 1, he went through a whole season without any significant injuries that we're aware of. It would be good if the second year of his sports he gets another impact testing, and then maybe another one after that. A lot of times, as I said, you don't have to have a significant injury to have some symptoms. So that if we can see what's going on from one year to the other, we can see whether or not maybe a child may not be able to return to sports if he has had several injuries. Our goal is to get these kids to do and to participate in the sports that they enjoy. We don't use these tests to try to say, no, you cannot go back, or, limit them in any way more than, to try to get them better. But what we're trying to do is make sure that when they do return to the sports, is that they return in the best shape, both physically and mentally, that they can. I've talked a lot. Anybody?
It's a good time for me to jump
yes,
in. I'm glad that Dr. Paparegina mentioned the return to play protocol, because the days of, you just had your bell rung, shake it off, get back in there, they're long gone. And nothing is more important to us in this district than your child, our student athlete. And I'm proud to say that under the direction of our athletic director, Chuck Donahue Jr., who's here tonight, we've instituted a much more aggressive return to play protocol than was mandated by the state. And so I want to give you a little bit of information about that protocol and what that looks like, and how your daughter or son will be returned to activity gradually over time with a concert of people playing in that decision. It's a team that consists of our school nurse, the athletic director, who's second to none, Joe Casino. He's an amazing athletic director and is very well networked in the medical industry. He's part of the decision. Dr. Todd Schmall, our school physician, is part of that decision-making team, as is the athletic director. And then once that decision's made for, of course, the main physician who's treating your child, once it's cleared from that physician, then it goes to our team, who then decides what the return to play protocol is, and then works that team with the point person being our athletic director, works in concert with the coach of the activity to monitor how his re-immersion into the activity is going, with us pulling back at any moment in time that there's a return of symptoms long before you, the parent, have to make a decision, I need to get back to the physician again, we are likely intervening because we're monitoring that athlete, your child's status on a daily basis. With that said about what our return to gradual return to protocol is, now it's time for me to give you information about what the testing administration looks like. Dr. Paparegina said sometimes if you test in large group format, it corrupts the quality of the test. Well, we've taken that into consideration and selected our 910 library, which has a lot of private cubicles spread over a large area, so we can service a lot of athletes at one time, but separated from the group atmosphere, large group atmosphere. And we also have set aside the several of the computer labs should our turnout the night of the mass testing be greater than the library can handle. The date is next Thursday night, August 14. Hours 4 to 6 is what we're publishing, but we'll be open as long as we need to if the walk-in demand is greater than 4 to 6 can accommodate. We won't open until 4. We'll be here, our staff, there'll be staff from the Southern Ocean Medical Center. Ashley, I believe, will be here. Her job will be to help with the paper, filling out of the paperwork and all the coding, the information that's necessary. We'll have a full complement of Southern Regional's IT staff here to help with the networking and any computer keyboarding problems that might be encountered. We learned last year that we had an abundance of staff that wasn't necessary, but we're still going to have that staff here so that it's a seamless transition for the athlete to come in and do the paperwork and then go through the battery of computer testing. We've selected 4 to 6 to coincide with all the practices. Next week practices are already begun. As we were starting this program tonight, our soccer players are being dropped off for their indoor workouts. So most of our athletes are already back on campus. All of them are back on campus next week. We've worked with our coaches to coordinate. Some practices will be ending right around that time phase so the athlete can finish practice and roll into the testing center. Football will be practicing at that time, but we'll be releasing their athletes throughout phases of those 2-hour time blocks so that they can get in and take it. And all of our coaches are embracing and encouraging your participation. But if next Thursday 4 to 6 or beyond 6 doesn't fit in your calendar, we've also made arrangements, and our secretary in the athletic office has already been trained in administering the impact test. So it's not a one night or you can't get tested. That's the kickoff night. You can get tested anytime thereafter, either in our athletic office or at the Southern Ocean Medical Center's Concussion and Neurology Center. So yeah, and also, if you, for whatever reason, you missed a baseline testing, as we test the child subsequently, in the first post-injury test or the second post-injury test, eventually at the end, as we're ready to have him or her return to sports, we will use his best scores at the end to be his baseline. In case he ever gets re-injured again, that score, the last one, will be his baseline as opposed to anything if he has missed doing it before his injury. So, but I don't think anything's more valuable than pre-injury, that test that we're hoping none of your children ever receive that kind of trauma that requires the implementation of a protocol, but if they should, then there's nothing more comforting to know that we had pure baseline testing before the activity or before the trauma occurred. So with that said, that was the information that we felt was important to get in your hands, and we really thank you for being here. But before we dismiss the evening, is there any questions or any points of interest that we didn't cover that you wish that we had? Or any questions about the testing protocol next week? Yes?
How long do you estimate the test to actually take?
It's about 20 to 30 minutes, really. It's about 20 to 30 minutes.
Okay.
It's fairly, it's fairly easy as far as instructions and the computers. Once they're done, it's usually, it can easily be printed afterwards. And as we said before, the test really belongs to you in the sense that, if something happens and you have that with you, if something happens somewhere as far as repeating the testing anywhere else, the impact testing is a standardized test so that if it's ever repeated, it can be compared.
And is there a place, as we're doing, the parents are filling out the paperwork, is there a place for us to wait? Something for you to do there?
Yes, I should have gone over that. That's a great question. Thank you for asking that. The question was, while the paperwork's being done and the child's doing the testing, is there a place for parents to wait? So the process is set up. If you park anywhere in the reception area, the 910, that's by the circular driveway entrance area by the flagpole, or over by the music and guidance complex to the north of the building. As you come in, there'll be a reception desk set up, and there'll be clerks there processing the paperwork. Your athlete, your son or daughter, will then go down to the library, and there's a sitting area in the main office or in the auditorium that the parents can wait. For those who are here on campus with a younger athlete, and then your child will return to you there. Okay? And for those who are the athletes there that are here on campus already, they're just going right back out to practice. And I think we were cycling them out pretty quickly last season.
One nurse who left.
Yeah. Good question. Any other questions? Well then, in wrapping up, thank you all for being here. Dr. Paparegina, thank you. I know how busy you are, but I know how also important this is to you and your Concussion Trauma Center, and to the point where you're taking time out of your day to be here. And for those in the viewing audience that couldn't be here but are watching us on SNN, please carve out some time for your athlete to come in and submit to a baseline impact testing. Thank you.